Namaste, I'm Dr. Nithin SG, Consultant Medical Oncologist at CK Birla Hospital, Punjabi Bagh. Today I'll be taking a few minutes of your time to educate you about a cancer which is preventable if detected early and completely curable if detected early, which is skin cancer. The month of May is considered as Skin Cancer Awareness Month all over the world, and various campaigns are being carried out to educate people about treatment, early detection as well as prevention of skin cancer. In India, the incidence of skin cancer is relatively low as compared to the Western world, but still it is in the rising trend. So what are the major types of skin cancers? There are mainly three types: basal cell carcinoma, squamous cell carcinoma, and the most aggressive form is melanoma. So what are the major causes for development of skin cancer? One of the most important reasons is skin damage that is usually caused by sun exposure, especially sunburns, sun damaged skin, especially those patients who go for sunbathing or even indoor tanning beds, those who use indoor tanning, which is not very common in our part of the world. And long-standing ulcers which are not healing can also get converted to cancer, especially the squamous cell variant of the cancer. So when are you supposed to suspect when there is a lesion in your body and whether it is a cancer or not? So most important thing is, if there is a newly formed lesion in your body, a new lesion developing which is rapidly growing in size, if it is bleeding, if it is oozing or itching, then definitely you will have to consult your dermatologist or physician and get evaluated for the same. Or if there is a pre-existing mole which is rapidly changing in color, or its borders are changing, if it is increasing in size, again it becomes itchy, oozy or bleeding, then definitely you will have to consult your dermatologist. Diagnosis is usually made by biopsy, and a proper histopathologist would be able to make a diagnosis of skin cancer. So how to prevent development of skin cancer? That is the most important point, especially in this time of the year, especially summer time when heat waves and heat strokes are very common. You have to hydrate yourself very well when you are going out. Use a protective clothing. In Western world and all, they use ultraviolet protective factor clothings with UPF factors, but in India we usually use any clothing can be used, but especially those who cover the areas, especially long sleeves, those with pants, not wearing shorts when you are outside, and using a hat which can cover your ears as well as eyes and the face. And always avoid outdoor work between 10 a.m. especially 10 a.m. to 4 p.m. when there is a peak sun exposure is there. If it is not possible, then use a shady area as much as possible. Then using a sunscreen is very important while getting outdoors. SPF, those sunscreens with a sun protection factor of more than 30 is ideally recommended, but 15 is also fine, with a broad spectrum coverage including UVA and UVB. It should be applied all over the body, especially on the ears, tip of nose, arms, as well as on the legs, as well as foot. And if you are sweating a lot, or if you are going out or outdoor sports or something, then always use it every 2 to 3 hours. You should repeat it. Sunglasses can also be used to prevent exposure to eyes, as well as we have lip balms with sunscreen content which can also be used. So diagnosis usually is made by a dermatologist or a medical oncologist, and most of these cancers, when detected early, are treatable with surgery. Some of these need a chemotherapy or radiotherapy, and melanoma usually is treated with immunotherapy at advanced stages. So be very careful, be vigilant, know about what are the warning signs in a skin lesion, and if at all any point of time you are suspicious, do visit your dermatologist or medical oncologist and clear it out. Thank you.